Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer and Founder of Atlantic Coast Aesthetics. And Dr. Pane, this question comes in from our website this week. The question is, will a fat transfer be needed after removing a butt implant? And there looks like emailing us from the North Florida area. So, Dr. Pane, what would you suggest?
Well, this is a good question, and it's going to be one of these, like typical of many, is maybe is probably the answer here. We don't have pictures here, and now technically speaking, is a fat transfer necessary after removing the implant? Well, no, it's not necessary. The question is it optimal for your shape? I would say the question comes up is, why was the implant placed in the first place? If you had buttock implants because there was not enough fat to do a fat transfer, or you preferred to doing implants as opposed to doing a liposuction fat transfer procedure, then there's a different outcomes there. If there was no fat and the implant is removed, and again, it could be removed for different reasons. Sometimes these can become infected even years after they're placed. That's one thing you have to keep in mind with implants. It is possible to get a remote problem years later. Not common, but it can happen. So if the implant comes out and there's no problem and there's enough fat available in other areas, I usually wouldn't do it at the same time, although you probably can get away with it. Most of the time you want to get the implant out, let things heal, come back, do the liposuction fat transfer. And if there's fat available, that can be done. I tend to be able to get fat in people when other folks maybe not so much. So I've done plenty of fat transfers in people that had been turned down. There are some special techniques. And again, you can't do it in anyone. There are people that have too little fat even for me, and in those people, they're better off with a buttock implant. So the answer is it necessary? No. Can it be done, fat transfer after removing the buttock implant? Yes. And probably best to let things heal, and especially if the implant was infected. If the implant was infected, you do not do the fat transfer at the same time. If it's being removed electively, you can probably get away with a fat transfer at the same time. It's usually going to be safest to let things heal and then come back. So again, that should cover the answer there. Essentially, it's a maybe, depends on the situation and specific circumstances. But overall, you need to do a consult with somebody that does these procedures in person and get a sense of what can be done to help you.
Well, thank you, Dr. Pane. And if you have a question for the doctor, please visit our website, Facebook page, Instagram, or Twitter account. And Dr. Pane, we appreciate your time, and we'll see you on the next question.
Great.